Are diclofenac strong? Diclofenac is a nonsteroidal anti-inflammatory drug, NSAID, that is commonly used to relieve pain, reduce inflammation, and manage various medical conditions such as arthritis, menstrual cramps, and migraines. In terms of its strength, diclofenac is considered to be a potent medication due to its effectiveness in providing pain relief. Diclofenac comes in different formulations, including oral tablets, capsules, gels, and patches. The strength of diclofenac can vary depending on the specific form and dosage prescribed by a healthcare professional. For instance, diclofenac tablets typically come in strengths ranging from 25 mg to 100 mg, with higher strengths generally indicating a higher concentration of the active ingredient. To illustrate the strength of diclofenac, let's consider an example. Suppose a patient is experiencing moderate to severe knee pain due to osteoarthritis. A healthcare professional might prescribe diclofenac in the form of 75 mg extended-release tablets. This dosage is considered strong enough to provide effective pain relief for the patient's specific condition. It's important to note that diclofenac, like any medication, should be taken as prescribed by a healthcare professional. The strength of diclofenac should always be determined based on an individual's specific needs, medical history, and the severity of their symptoms. It's crucial to follow the prescribed dosage and any additional instructions provided by a healthcare professional to ensure safe and effective use of the medication. In conclusion, diclofenac is considered a strong medication due to its potent pain-relieving properties. The strength of diclofenac can vary depending on the specific form and dosage prescribed by a healthcare professional. It is important to consult with a healthcare professional for accurate dosing and to ensure safe and effective use of diclofenac.